My name's Paul Bailey,
Member, member of
member
Ascending
of
Health.
Ascending to Health, staying at the R.J. Montgomery Center.
How long have you been at the R.J. Montgomery Center?
I've been at the R.J. Montgomery Center for, let's see, a month and a half now.
Okay. Um, where were you before Colorado?
I was in Indianapolis, Indiana.
Paul, tell me about the first time you remember being homeless.
The first time I remember being homeless was up in Minneapolis, St. Paul, Minnesota. Uh, I went up and took a friend's mom there to visit her daughter, and due to unforeseen circumstances, I became homeless and figured out very quickly that it's very, very cold up there for someone my size. I don't weigh very much, and cold weather doesn't do me very well.
Do you feel like elaborating on unforeseen circumstances?
Uh, the deal was to bring my friend's mom up there, and I was supposed to be able to stay up there indefinitely until I found, or not indefinitely, but until I found work. And after 2 weeks, 3 weeks, I think it was, the daughter said, "Hey, you're not finding any work. You gotta go hit the road." And she didn't hardly leave me any time to get any of my stuff out of her place, and I was out on the streets before I knew it. So it was not a very fun circumstance.
Do you have a skill set that's valuable to the workforce?
I'm very good with technology, but I don't have any official education. But I have gone to college to become a pharmacy tech, and have my certification for that. I just can't do the standing due to my disability for the job.
And what is your disability?
My disability is neuropathy and myopathy due to type 1 diabetes.
Does this prevent you from getting a job that you wish you could get?
Oh, absolutely. I wish I could work driving semi truck again, work in the factory again. Many things, the old jobs and upcoming jobs that I just never could have. It just stops me from being able to do it.
All right. Stops you in what way?
Um, it I get worn out easy. I have problems sitting for a period of time. A really hard problem with standing for a long period of time. Also, I can't walk very far, and I can't lift very much weight. So I can't go back to the what I used to do when I was younger and factory work, lifting just pallets or like boxes of stuff. I just can't do that anymore.
So, with that being said, what options do you have to live?
Currently, the options I have are to become disabled and to live on a small disability check every month based on what I've earned for the past 10 years of work. And it's not easy. It's a struggle every day to get by on that meager wage. It's
What's the
not like
biggest
normal work.
snag living on disability?
Not being able to afford food, medicine, or to choose between food, medicine, housing, uh, being able to get around. Everything's a choice. You can't just do everything you're used to doing.
Um, when it comes to being homeless, how do you feel about the cliche "just go get a job" comment?
That's a very circumstantial question. it seems from my experience being homeless for, let's see, 6 and a half, 7 years now. I think that's how long it's been. That some people could easily physically, maybe not mentally, but physically go out and get a job, but others physically can't, or others mentally can't. It's a very circumstantial, depending on the person, depending on the part of the country they live in. Certain places of the country are easier to find a job in. Certain places are easier and cheaper to live in, but then the jobs aren't there. So it's, like I said, very circumstantial for that one.
When is the last time you can remember living instead of surviving?
Uh, 2005 when I was working, actual job, not just being homeless or with that small disability check. You you just survive on disability or being homeless. You go day to day.
If someone offered you a place to live tomorrow, would you take it?
Yes, as long as it was affordable within my means.
And what would be a price within your means?
Personal means, I would say $550 or less with utilities included a month.
Have you seen very many places that fit the criteria you're looking for to live a independent life?
Not here in the Colorado Springs area. And the few that I have seen, not the nicest places, and not somewhere where you would live. It'd be just somewhere to get by until you found something better.
Do you feel like that's a productive option or a trap?
It's a trap. Absolutely a trap. You,
Because
you sign into a lease, you get stuck there, you don't get ahead, you don't get anything saved up, and you're stuck there. There's no way out. It's just a nonstop cycle of living paycheck to paycheck or month to month or day to day even, like as in the hotels here in town. That's a week to week thing. You can't get out of it unless you want to go back out on the streets.
with your own place, do you feel like you would be able to put the hard work in that it takes to live independently and still always want to improve your situation?
I think once I found a place that was steady and not a trap, yes, absolutely. Be able to improve myself to the best that I can.
How would you keep yourself from becoming complacent once you got what you wanted for so long?
It's always a struggle to even once you do find a place that is affordable, you still have to struggle with Medicare, Medicaid, um, and still you have to go out and you have to pay your bills. You have to go out and do grocery shopping, go to the doctor, fill your prescriptions, just live a semi-normal life. It may not be normal to what you would be used to, but it would be more normal than being homeless, at least to the average person.
Is there anything else you would like to say to somebody who does not necessarily understand or respect your situation as of right now?
I wish there was a way to allow people to live in the shoes, walk the mile for a while just to see what it is like, to see how you're treated walking down the street being homeless. Uh, some of us are better, more clean cut than others, but there's some that you look at them and they may not be homeless, and they look it so they get treated like it. Uh, and I'd like people to be able to experience what it's like to be treated like it. Maybe they wouldn't treat the homeless community like that.
What do you think the most eye-opening realization a person like that would have if they walked in your shoes tomorrow?
How difficult it is to carry everything. You have a pair of pants with extra pockets in compared to, well, maybe not extra pockets, but you have everything you own in your pockets. If you don't carry a book bag, you have everything you own in your pockets. And to go searching through them is quite a task some days to find exactly what you want in a timely manner. And even as to finding your ID, if you need to go into a store and buy your prescriptions, finding your ID sometimes it's like, did I forget it back at the camp, or did I forget it back in my book bag? Is it not in my pocket? And that would be the biggest eye opener, I think.
Cool. Well, there's one more thing. Um, I've been screening for housing and whatnot, and we're probably gonna wind up putting you into an apartment.
Oh, okay. Are we done?
And having a place to go.
That would be awesome. That would be very awesome.
How do you feel about that?
I'm relieved because
Actually, I got the keys right here for you.
Holy cow. Wow. Thank you.
You're welcome.
Thank you, Kurt.
Yeah. You're welcome, Paul.
Thank you.
You want to go check it out?
Absolutely.
All right, let's go check it out.
Wow, I wasn't expecting this. Thank you.
You're welcome. You're welcome.
Thank you.
I want you to put the hard work in. I want you to always be honest with me.
Always.
And always want to improve yourself in the smallest ways, and we'll do great things together. I know it.
Awesome.
Right on.
Awesome. Thank you.